Hi, thanks for joining us for Nevada Week Extras. We're talking access to affordable health care. And one thing that we didn't touch on the show itself was some of the fraud and some of the scams that are out there. Give us an example. I'll start with you, Julie. We got to be careful.
Right. So there's a lot of fraud actually happens at the provider's level. So if you're insured, it's common in Medicare. If you're insured and you have Medicare and your provider's asking you to have a procedure and you're not really sure, fraud usually doesn't happen at the individual level. It's typically provider driven. One of the best ways to combat it is to get a second opinion. So don't just take necessarily the first opinion from the first doctor. You're allowed a second opinion and go and see another one and see if they agree with the initial selection. The other thing is when people are robocalling you, and I promise it will never be Heather who's robocalling
I
you.
definitely won't do it, but yes.
Don't call, just like if someone's calling about your phone bill or from the IRS, don't call the number back that they leave on your phone. Look them up and call the number that's on the website. Then you know for sure you're talking to the right people.
It's always best if you make the call. If somebody
Yes.
calls you, you have no idea where it comes from, correct?
Right, and I would add that if something sounds too good to be true, it is. If someone's telling you that a premium is something insane like $18 a month, then that is likely not going to be a plan that is going to cover all of your medical needs, and it's probably actually a scam.
Randy?
Yeah, and again, when you're looking for a provider, that should be a very connected relationship. So especially if you have something that is risky or complex, you're having neurosurgery, you're having spine surgery, something like that, you should really check out your providers. There's plenty of ways to look and see, to make sure that they've done this, to ask them those questions. What's your post-op infection rate? How many procedures have you done? People do a lot of research on the people that are going to paint their house. I think you should, look into the organization that's going to take care of your body.
That's a good point, because oftentimes when you go to the provider, you think, well, they're all knowing. And is that the case? Holly, I mean, what would you say? I mean, it's scary for people sometimes.
Oh, for sure. And I think there's so much information out there, especially on the internet. There's a lot of websites that you can go to, but check it out and get a second opinion for sure.
Yeah, especially when you need that. And then behavioral health is a perfect example. Not everybody clicks with their therapist. So, making sure that you connect, that you're on the same wavelength, that you speak the same language, that is an important thing.
And call your insurer. They're your partner in this. They want to make sure you're getting good care too. So if you have a bad experience with a provider, or if they're telling you something and you're not quite sure, call your insurer and talk to them, and they can help you. They want to make sure you get good care as well.
What about the people, and we were talking a little bit before the show started, about the people in the poverty level, the 400%. I mean, it seems oftentimes that they kind of get left behind.
Absolutely, because the Nevada Health Link subsidies cover between 138 to 400% of federal poverty, and it's $48,500 for an individual is about 400%.
And how much for a family? Is there a set?
For a set of four,
Family of four, right.
it starts at 40,000 and it goes upward from there.
Yeah, between 100.
Probably I think 40.
So if you're in that
There's a
income
calculator
range,
on
check it
that.
out.
Check it
Right,
out.
right. And so people who are over 400% of the federal poverty level are not eligible for subsidies. And that means that they're paying the full sticker price of their insurance. And so over 80% of our consumers are eligible for subsidies, but those people who are in that 20 percentile, or the 20 percentage, they're really paying the full price. And when prices go up, they take the whole hit on that. They eat the whole entire increase. But people who are subsidized, when their prices go up, so does their subsidy. So they don't feel that.
Yeah, and this is the exact reason why the Affordable Care Act sort of had some movement. It was happening beforehand. It's that growing price. So the employers were seeing that. The IBMs, the Google, everybody else saw that price, and they said, "Wait a second, we're going up and up and up." So I think what will happen in the future, and this is a topic for certainly another show, is, what does the value look like in healthcare, and where can you begin to have, more of a value versus a volume-based system, and you really start to deliver good quality. You're showing that your, heart attack risk drops, your obesity rates drop, your vaccination rates go up, And that's going to be the exciting thing. That's what I'm looking forward to see in the next generation of healthcare.
When the ACA was introduced and passed, it was called Obamacare, nicknamed Obamacare, and it was a political dividing line. It didn't matter
Still
which side of
is.
the aisle, it still is. Now, my question, though, it is in terms of the politicians and policy making, but in terms of the patients and the clients, has a lot of that subsided?
I think people, when they get used to having coverage, when they get used to recognizing, like, I'm a cancer survivor, and so pre-existing conditions is a really big deal to me too, and not having annual and lifetime maximums, which means that I can't hit the maximum regardless of how expensive I am. Those are really big changes that were quality of life changes that made a huge difference for a lot of people. It's really difficult to roll that back. I think that people saw that. That became, a call, was pre-existing conditions are important to us. And we may be on different sides of the political lines, but none of us are okay with people having to not get coverage because they have a pre-existing condition. And I think that was one of the things that the ACA, before that, there were a lot of people who were afraid if they had a child born with a disability to let their employer know or to put them on their employer's insurance because the premium would go up and they could lose their job. And so we built systems around, you don't have to tell your insurer that you're getting coverage for your child with a disability so that people wouldn't lose their jobs. That doesn't happen anymore. I mean, you can get coverage for your kids, and that's a big change.
Yeah, and I totally agree. And one of the things that I've noticed over the last 6 years at the state legislation level, we've seen a real embracing of the Affordable Care Act in terms of how beneficial it's been for Nevada's economy and our job market.
Right.
Good thing. Thank you all very much.
Thank you.
Pleasure having you all here.
Yeah.